Say morning or an afternoon. Thank you, Lundbeck, for having me here. It's a great pleasure to be here. And after both the Matthew's talk, I do not know what I'm going to talk. So you left me nothing to talk about. Dr. Usha was so good. So mine will pale into insignificance but still I'll have to tolerate it. I'll go quickly through the thing because I don't want to keep you all away from the lunch. I think I was supposed to talk much earlier, but you have to tolerate me for 10 minutes more. We have always been talking about problems for the elderly. We know what the problems are. And every conference I go to, I start saying, okay, let's see what we can do for them rather than talk about the problems of the elderly. But even before that, what are the solutions? Because I strongly believe that support system should be quickly done, not only by the community, by the government, but by the senior citizens themselves, the state governments, the NGOs. All of us have to get together if we have to make a difference for elder care. We have been caught by this sudden problem. India was never geared up, as you already spoke about the joint family systems, the fragmentations, the urbanization, all have made a vast problematic areas for the elder care. And what are we going to do about this? The state government is still not aware of where they are leading to. They still don't know what to put into practice as to how to deal with this number, such a vast growing number. So let me quickly go through this. Yes. So again, I don't want to repeat it. This is life expectancy is increasing. As again and again I said, as a medical person doing home care, I used to see patients between 65 and 70. Now I see patients between 80 and 90 at home. So they are the fastest growing age group. And elders population in Bangalore, Karnataka is about 9%. And in 2050, the number of young and the old are going to be the same. So you can imagine the magnitude of the problems. What are we going to do? Now, I'll just restrict to social, emotional, and physical problems of the elderly, and how are we going to tackle this? Now, I have not added financial or the other situations because it has been dealt earlier, but probably it will come under social and emotional problems. Now, when you come to physical factors, now what are we looking at? Health. Now, what is the access to healthcare? How you know very well that we are not able to access healthcare is because, health is usually afforded in the hospitals. The traffic woes, the long waiting in the hospitals. What about the chronic diseases which you go to up and down for many visits to the hospitals? Who is going to take you to the hospitals? So the access to healthcare, especially in rural as well as the urban areas, is going to be a tough thing. Affordability, yes. That's another question which is rising. Affordability is in question. Increasing disability. We have already spoken about the chronic diseases and the comorbidities. Ambulation difficulties, yes, we are not able to travel, is because of the same comorbidity. Geriatric services are very much limited. You all very well know about it. Elder-friendly features. If you see in the city, not even the pavement you can walk. So the elder-friendly features themselves are not there. The ramps are not there. So many of the things are lacking. When you come to emotional factors, now I just quickly go through this so that we see how do we tackle with each of them. Emotional factors, respect and dignity, self-esteem, we have already spoken to in great length. Decision making, they have not been allowed in decision making is, very well at the homes, none of them are taken into consideration because the younger ones are deciding for you and they say, can you stay back because you have done it earlier and you're not anymore fit enough to make more decisions. Are you an integral part of the family? I still feel you're there, but I do not know whether you're still the integral part of the family. Abuse. Now when I talk, I am not talking about this group which is sitting here. I'm talking about the abuse which is rampant outside. About 40% of the people are emotionally or physically abused. You will not believe this, since I have gone through this 15 years of practice, seeing through various other projects. Abuse is on the rise, especially nowadays because of property issues. There are other things intergenerational where you cannot understand each other. So this gap is widening and the elder abuse is on the rise. Now, when you say about the social factors, the perception of the elderly, as you say, even the media do not want to project the elderly. And if it is projected also, what sort of a sort do come up? Any glamorous roles? No? None of the senior citizens are shown as glamorous. So it looks like the children perceive it as like old, withering, dithering, falling off. So that's the perception of elderly by the everybody. I'm sorry. Reduced participation, yes, because there's no role to play. Family disintegration, I don't have to talk because the joint family system is already slowly eroding. Financial instability is sometimes the senior citizens do not want to depend on the children. I don't know whether there's a fierce independence in them or the children do not want to support them. It's both a combination of, that's the reason for another financial instability. Separation, yes, most of the children are gone abroad, is your own wanting them to be abroad and having nobody here to take care. Shrinking social network is your friends are also old enough that they're not able to come back to see you. Now, I go back to as to my views on how to take care of the elderly. Now, I cannot talk from just the books. I can only talk about the models which we set up. And I feel these are the ones which can address most of the issues. And the model which we have created is to see that there is a comprehensive care of the elderly. It's just, so we will be looking into the financial, it will be looking into the health, it will be looking into the psychological effects and also the financial. So, and I always strongly believe that the elders should be part of the family. And once we create these support systems, most of the elderly can stay at home. The children also find it easier to manage them. And also I think the elders also want to be part of the family and to be an integral part of the whole society. And how do we fill it up? Because many times the elders used to call and say, why don't you come home and do the service? Because we find it so difficult to come to the hospitals. I used to ask the hospitals to do this for us and say, why don't we go there and do it? But 15 years back, nobody heard about this, so they refused about this. So I came outside, started this, along with another person who is not here to talk to you. So both of us started this at my garage at Sadashinagar. And it's not that I'm going to talk to you about what I did, it is just I'm going to tell you it is the need of the hour. The thought process caught up quickly, and this is a need in Indian society, especially in the urban areas where it is so difficult to reach a hospital. People are so finding it so, once you go to the hospital, you're lost because you do not know what to do. And you have no control about the whole thing. You cannot say anything to the doctors, you cannot stop anything, you cannot say, okay, stop at this. So the cost also rises. So this thing caught up, and we're looking after about nearly 5,000 families. And every day is a learning process for me. It's like you don't even see the health part of it. You also see the emotional part. You see the psychological part of it. You see the whole family as such. So, and looking at each thing, you understand as to what are you going to proceed to do much more for in this step. Because I believe there are people who are good in advocacy, who can take this forward. But I believe in how do we give the care services? How do we promote this? And how do you make these sustainable models? Now we have created a sustainable models. These can be replicated elsewhere so that most of the problems of the elderly can be looked. Now when you come to home care, this is how it is. You improve the access to health care. It's also accepted well by the family is because you know very well the senior citizens are scared to be in the hospitals, especially when in the ICU. I see terrified faces because they do not want to be there. And chronic cases need not be in the hospitals for a longer time. And also people are not there to take them. So I think there's an answer to address healthcare. So this is the services: nursing care, care at the home, preventive health care, additional care, regular follow-ups, care for the chronic illness. So this is part of what we are doing, providing all the health care at the doorstep of the elderly so that they do not have to go to the hospitals except cardiac cases, which will be difficult to manage. Now, when I say about the daycare, I see some familiar faces who know about the daycare and the enrichment center. So there are about 5-6 of us here, them here. They will tell you what a daycare has made a difference to the emotional support. Now, daycare thing is, there are three types of what we have. One is for the people with a middle income and above that, and for the lower income group. So we have two different daycare centers for two socio-economic care and also recreation and cultural programs. So the midday meals which I'm talking for is for the lower socio-economic groups, so this is what is one of the lower income group which we're looking at, wherein health is provided, and there's also an income generation scheme here, so that when I'm talking about it's the different strata of elderly which we are looking at. We are not looking at the only one sort of a class. Here when you need income generation is because their self-esteem goes up. They are able to produce some amount of what you call as income. Now, specialized daycare centers also we have, wherein Matthew has spoken in length about dementia, which I was particularly interested is because what I told you earlier, now the longevity is increasing and I am seeing a lot of dementia care at home. So how do we address this? It's not only by home care, but also having dementia daycare centers. So we have dementia daycare center, 2 dementia daycare centers, which look into this. Now, what is residential care? Now, I told you hospitals are a must and residential care is required. But you need a comprehensive one. You need a respite care, you need a short-term evaluation, you need a long-term evaluation, you need all the services under one roof. So this is how one should think about a residential care. Now, one of the models of our center is the Nightingale Center for Aging and Alzheimer's, which I will quickly just show it to you. Here the services are for assessment, short-term, respite care, a day care, and a long-term care. So here, the patient with dementia, you know very well, it's very difficult for a person to be shifted from one person to the other, one place to the other. So everything is provided under one roof. And we have an 80-bedded facility, which I don't think anywhere else you have such people under one roof. So this is one of the services. And again, when I repeat this, it's not to talk about my models. It is about how do you replicate. And I have shown this, that these are all sustainable models. And we don't have to wait for the government to do it. It can be done by the community, by the NGOs, and by special organizations. Now the outreach programs are, now everything doesn't have to be in the care, it can be also from the community. What we do is the rural mobile medical care, which we go for about 25 villages, which we do this. Teledementia to reach these services, because everywhere we cannot be there. And community screening and awareness, very few, I think, understand this, community screening and awareness, so that people are aware where are the services available and how it can be done. Now, rural healthcare, this is what I told you, is you can do the periodical health checkups, preventive health, and also screening and awareness. It's very, very important for the rural health is because the transport systems are so poor, and how do they reach? They have no access to healthcare. So I think in the rural scenario, we need a lot of mobile healthcare to be implemented. Now, I finished with the physical healthcare, and what are we doing about the emotional well-being? Earlier, Matthew told me that about the elders helpline. We have a helpline called 1090 with the police, which is in the commissioner's office, police commissioner's office, which is in Infantry Road. This was for the past 10 years it's working. And here, all the issues pertaining to the elderly, let it be the property issues, let it be the intrafamilial problems, or it could be civic problems, it could be any sort of a problem, or elder abuse. Now, the major thing is elder abuse. I was surprised when we started the Elders Helpline. Within a span of 2 years, I realized about 57% of cases which come to the Elders Helpline are due to elder abuse and intergenerational problems due to property issues. So you can imagine, anybody throwing their parents out or fighting about it, and it is quite amazing that 57% of them come with this sort of excuses there, and where legal support is free here. I would say one of the things about another emotional thing is mitigating loneliness is our Elders Enrichment Center, which we would call it. I wouldn't call it as a daycare, it is more an enriching center. Here there's a thing of nearly about 450 people who have not developed dementia for the past 10 years, who are sitting here. So that itself is a proof that you can enrich the lives of the elderly without taking too much of time of yours, because there's everything there. There's the emotional bonding. You can see them emotionally bonded. You have their self-esteem is high. So that's a proof here that enrichment centers are a great need of this hour. Helpline, these are the services which are going in the helpline. Advocacy is a very strong factor, because very well know that any policies, advocacy should be a very strong point. Unless we do this, none of the policies are going to be implemented. As it is, though we have the Maintenance Act, how many of you all are aware of the Maintenance and Welfare Act of it? Because till today, even though it has been come into Karnataka, very few senior citizens complain about their children. The maintenance is a must, otherwise the person is taken into task. But how many of them have done it? It's very, very difficult, is the senior citizen's attitude. But in certain states, like I think it was in, not states, I think it was in Coorg, they were able to get about 37 cases where the children, the senior citizens have taken up this against their children for not supporting them. There are many more acts like this. And the policy which is coming up of the national policy, but sad to say, I do not know when it will be implemented. The funding is also very poor, and advocacy should help in all these matters. This is our Elders Enrichment Center with various activities. Yeah, now this is another thing. Now when I spoke about, I think very few slides, this is the last slide probably, ensuring social well-being of the elderly. How do you do this? Financial. Many of them, they have a gap. They do not know how, because of the rising cost of the medications, or the children not supporting, or they do not want to be supported. Now how do you enhance this? So we have a project called Job 60 Plus, wherein we train the people with computers, free training computers, soft skills, vocational training, and see that they are placed in certain jobs. Now recently we had a job fair for the elderly, which about 1,000 people applied for the jobs. You can't believe that. They stood from morning to evening, afternoon. And I was quite surprised that they still want to work. And what are the things? Many issues came up, like, I want to augment my income. It's not enough what I get. Today morning was one great thing is somebody called me up and said, I was getting 3,000, and after applying to a job fair, St. Mark's Hotel has taken me. He's going to pay me 9,000. I said, that's nice. And he was so happy about it. So I think empowering this elderly, I don't believe in this pensions and asking the government, come on, give me some money, and it's not working. It's not working. So how do you empower them? All of you have to join together. It's not my job or anything. It's the community's job to get together and say, how are we going to take this forward? How are we going to empower? Now here I appeal to all of you that you should try to get some more people who can employ these sort of people. Because from 60 to 70, they are still capable of giving much more to the society. Why don't we do this? So each one of you, when you go back, at least if you could identify some more employers, it would be of a great help to this. And also for the skill development, you could come out with more ideas. I'm telling you, this empowering of the elders, if we start here and make it a success, all over India, we could do this. And there's nothing better than this particular part of it as being, you are independent. You are independent, you're going to do this work. This is the Job 60, wherein the person is for vocational training and computer training. And also, I told you just now about our advocacy programs in the Alzheimer's. Yes, we walked the 60 kilometers. The first day was terrible because it was sunny and I had to push and pull myself because the group was a little younger than me, so they could walk But I said, no, I have to complete it. If I'm going to talk about advocacy and I don't walk, they said, ma'am, why don't you sit in the car and come and we can cheat on this? I said, no, I'm not going to do this. My toes were paining, but I said, no. The second day was much, much better. Now, why I'm saying this is to you, you have a goal. You want to perform. You want to do this. It will happen. It can happen. Now, we have submitted this memorandum to the government, and I need all your support to see that this comes true. So I know aging gracefully, everything has all been covered by the Matthews, but here I come with an advocacy appeal as to see how this aging gracefully can come forward unless the community and all of you support us. So thank you so much for this, and we will add colors to the gray hairs. That's our motto. Thank you.